Well, I take the subway every day. And, sometimes it's pretty crowded if you get on, if you're lucky. I have to say that I try to not touch the bars. And if I do, I go and wash my hands afterward, hand sanitizer, to touch any surfaces. Not because I think they're contaminated, but there's so many people you just don't know. And this isn't the only virus or organism that can survive on surfaces. So it's just good practice. And if I'm sitting near someone who's coughing, I tend to move away. But just in general, it's something I do every day. I have no concerns, but just keeping in mind sort of, regular hand hygiene, cough etiquette, trying to not to be too close to people. This virus can, the droplets spread about 2 meters or 6 feet at the most. Well, I think for every gathering that people are planning, they should be consulting with their local health unit to do a risk assessment and determining, what kind of activities are being planned. What size of gathering is it? Is it, 100 people, 1,000 people, 20,000 people? Because those factors are very important. Where are people coming from? Are they coming from different countries, or are they all local? Are the people coming high risk? Are they old? Are they people older? Or people with underlying health conditions? Those all go into the factors in deciding.
And one of them, interestingly, is whether the gathering is indoor or outdoors. Because again, an outdoor circumstance is you have much freer airflow and less likely transmission directly from one person to the next, just given the airspace. So these are the kinds of considerations that need to be taken into, that have to be taken into account as one makes a decision on the mass gathering or the conference. I think fundamentally, each situation in each country is unique.
It's not a yes or no answer, though.
Yeah.
It's a consider this and that, and then, so, I have friends who are asking me, to be honest, and they figure, I would give them the straight goods. And of course, I would tell them whatever I know. And it's not a yes or a no. These are the things you have to think about. And at the end of the day, is this something that's important enough that you still want to go? And what precautions can you take? As Dr. Davila said, no matter where you are, the most important thing you can do to keep healthy is to wash your hands frequently. Yeah. It's very boring, but it's true. And, cough into your sleeve or tissue and stay home if you're sick. I mean, it doesn't even matter where you are. Those are the most important things.
Right. And as with any medical situation, right, we're offering medical advice. Mm-hmm. And it is unique to the particular situation. As Dr. Yaffe points out, there are unique risks and characteristics within each one of those situations. So unfortunately, there isn't a simple yes or no answer, but there is a list of considerations that people can go through and reflect on for themselves so that they can come to a decision that makes sense for themselves and their families. There are general guidance and principles that exist. Clearly, when we see more widespread, in a circumstance with more widespread community transmission, you are then in a position to implement or deploy more significant public health measures, such as, more significant social distancing, banning mass gatherings, that kind of thing. But you want to make your measures proportionate with what's happening in your circumstances. That's why I think it's important that people recognize that, we focus on the measures that make sense for the circumstances and what we see at the time. And as the situation changes, the response changes.